started here, we want to take a look at anatomy really quick so that we know exactly what we're trying to work on. So a lot of times when people think about the core, they might think about just like the Hollywood six-pack of abs, or if someone is talking about incontinence or pelvic organ prolapse, you might only highlight the bottom of your core or your pelvic floor. When in reality, what you want to focus on for your core is the entire system of muscles that make up your core. There's both deep muscles and superficial muscles, and we're going to start focusing on just the very deepest layer of muscles, and we're going to work our way out. And so I want you to sit up tall with me for a second, and I want you to imagine that your torso is a cylinder, and it has a top and a bottom and a roundness to it. And so at your innermost core, and the ones that we're going to initially take a look at, is your diaphragm. And this sits at the very top of your cylinder. It comes down and around kind of like a little bit of a parachute just underneath your lungs. And as you breathe in and out, you know, it rises and falls with your breath. At the bottom of your cylinder, rising and falling with your breath is your pelvic floor. And so as you inhale, your diaphragm comes down, your pelvic floor comes down, and then as you exhale and your diaphragm comes up, your pelvic floor comes up as well. And your pelvic floor sits down there in your pelvis, kind of similar to a trampoline. And so you want to think of your pelvic floor as something that always has to have a little bit of tension so that things don't just fall out of your body. But it also needs to be able to relax and flex as needed so that as you jump or cough, you know, and the pressure within your body changes, it can withstand that pressure and move with that pressure to continue to do its job. Coming around your body is your transversus abdominis, or your TVA, and this is like your core set muscle. And these three muscles, your transversus, your diaphragm, and your pelvic floor, are all anticipatory in nature, meaning that they contract just microseconds before your body actually needs them to in preparation for the movement. So there's a real coordination piece that comes with those three in particular. So that makes up three sides of your cylinder, and coming up the back of your cylinder or coming up your spine is a very small muscle called your multifidus. And this muscle is often overlooked in fitness, but it's very related to low back pain. So we want to make sure that we address that one as well. So these four muscles are four of the main muscles that we are going to focus on. And then on top of those, there's additional muscles, or additional abdominal muscles that are on top of them. And then around them, there are groups of muscles that we don't want to forget about as well. And so we want to make sure that we look at your glutes or your butt muscles. We want to look at your hip flexors, the muscles on the outside and the inside of your thighs, your quads, your hamstrings. And then from there, we'll work on the innermost muscles of your core. We'll work our way out into all of the different systems and into your entire body. And what we're trying to do with your body and with these muscles that we're addressing is we want to first make sure that all of these muscles have a lot of suppleness to them, or the ability to go through the full range of motion. So sometimes in your core, you can have muscles that hold a lot of tension. And so they might be just like, you know, sitting there squeezing all the time, and they have a really hard time relaxing. Well, if a muscle is squeezing all the time, it can't go through its full range of motion, and so it can't do its job properly. So for example, imagine squeezing your bicep, and there's always a lot of tension here, and it really can only go through this motion. So you want to focus on releasing and relaxing that muscle so that it can start all the way down here and come all the way back up. And that's very similar to some of the muscles that we're going to see in our core as well. So we're going to work on flexibility in our core and releasing the muscles in our core to release any unwanted tension. We're also going to focus on strengthening these muscles. And so we need to look at both an endurance kind of strength, you know, can they hold your posture throughout the day? Can your trampoline maintain its tension throughout the day? So we want to make sure that those muscles have endurance, but we also want to make sure that they have strength for acute movements. You know, what if you cough, or what if you jump or run? You know, are they strong enough to handle that increase in pressure and increase of force? And then we also want to look at the coordination of these muscles. And so all of these muscles in your core, in this system, work together to do their job. And so are they working in synergy, or are they kind of out of sync? Are they working in synergy with your movements? Are they working at the right time and in the right form? Or again, are they out of sync? And so we're going to look at the coordination of those muscles. And so as we move forward and with all of these videos, those are the muscles that we're going to be highlighting, and we're going to work on releasing them, strengthening them, and then the coordination of them. In our next video, we're going to go over the ABCs of your core, which is your alignment, your breathing, and then the coordination, the contraction of your core. We're going to put all of that next piece of the puzzle together.